Welcome back to Toledo Clinic TV. Our guest is nephrologist Dr. Mariano deMiguel, and you're here to talk about the aging kidney. And my guess is very few of us think about our kidneys unless there's a problem.
Right, exactly. Well, this is a very interesting topic that both for geriatrics as for clinical nephrology. And it starts back in 1999. They did a change in the way we measure kidney function. Until then, we would use a blood test that measured serum creatinine. It had the disadvantage that there was a wide range of normals because the serum creatinine actually depends on the body mass. So as you can understand, small people have small creatinines, large people have large creatinines. Women have smaller creatinines than men. African Americans have larger creatinines than Caucasians. So in 1999, thanks to the magic of mathematics and some smart people and a lot of information, they were able to obtain a calculation using the serum creatinine in the blood, and they used what they call a GFR, which is a more understandable number. Since GFR usually under 59 would be indicating moderately advanced chronic kidney disease. GFR is less than 89, just a mild change in kidney disease. And since they started using these GFRs, they noticed that there was a larger and larger group of elderly patients that qualified as CKD. Actually, more than 50% of people over age 75 qualify as having chronic kidney disease. Now, when we look at this, these people were totally normal. They hardly took any medications. They were healthy, elderly individuals. The way to explain this is that there is a process, an inevitable, natural, biological process where the kidney declines in function. As a matter of fact, as we get older, unfortunately, we lose our eyesight. I got to use my glasses. We lose our hair. We also lose kidney function. After the age of 40, give and take, we lose 1 ml, given, let's say, normal kidney function being 100 mLs a minute, 1 ml of kidney function is lost every year. Depending on how much kidney function we're born with will depend on the people who will develop clinical CKD that I mentioned. Usually, when we're born, we are fortunately born with much more kidney function than we need. Some people have 150%, some 120%. If you do the math, if you're 120, in 40 years, you'll probably have chronic kidney disease. There is a distinction that we have to make, though, between these healthy, elderly individuals and people who have chronic conditions, such as hypertension, such as hyperlipidemia. These conditions can not only deteriorate your health, but they can also further deteriorate your kidney function. So we must not confuse. It's not that everybody, people with diabetes, hypertension, hyperlipidemia, are, yes, at risk of having progressive kidney disease and are at risk of needing dialytic therapy if these conditions are not controlled, different from the other population.
Now, what would a symptom be if someone's walking around and they think that their liver or their kidney function rather is fine, but you're saying it is on the decline? What symptoms might they
There are
notice?
no symptoms of kidney failure. The symptoms come when it's way too late. That's what happens. And before the GFR, all these people were just being missed. They were healthy, they were fine, nobody did their kidney function testing. Now they go to a doctor, they get their creatinines, automatically they get a GFR. And this is why I wanted to point out that these healthy individuals do not have to fear. I would say that the take home for this is they will not progress to need dialysis. They will have to do some changes with certain medications that are renally excreted. We'll have to have some care with that. They are also more prone to acute renal failure because their kidney reserve has shrunk. So IV contrast, nonsteroidals should be done with precautions and avoided if possible. Other than that, these individuals do not have anything to fear.
So is the test the GFR test? Is that a regular screen that a person
Every
might have?
time you have a blood test, yes, you automatically get a GFR. And the GFRs have also been divided per race, okay? Caucasians and African Americans. Since the African Americans have more muscle mass, their GFRs are slightly different.
That's a good information.
Yeah.
Something I think most of us probably never even think about.
Right.
All right.
Right.
Thank you so much.
You're very welcome.
We'll be right back.